Good evening, everyone. Today we are discussing about the basic life support. It is not a AHA workshop, but it more like a practically how we are dealing with the unconscious patient, how we should relieve a choking patient, and how we should resuscitate without any special equipment, with only our hand and presence of mind. How can we resuscitate the patient? That's what we are learning today. So basically, I am an anesthesiologist. We will be dealing patient in critical areas like ICU, operation theatre, and also pain management. It is a small self-explanatory video which is showing what is the importance of heart and how it works.
ಇದು ಸ್ನಾಯುಗಳಿಂದ ಮಾಡಲ್ಪಟ್ಟಿದೆ. ಇದು ಒಂದು ಪಂಪ್ನ ಹಾಗೆ ಕೆಲಸ ಮಾಡುತ್ತೆ. ಈ ಪಂಪ್ನಿಂದ ರಕ್ತ ದೇಹವನ್ನೆಲ್ಲಾ ಸುತ್ತಿ ಅಂದ್ರೆ ಪರಿಚಲಿಸಿ ಹಿಂತಿರುಗುತ್ತೆ. ಇದು ಎಲ್ಲಾ ಕಡೆ ಹೋಗುವಾಗ ಆಕ್ಸಿಜನ್ ಮತ್ತು ಇತರ ಪೌಷ್ಟಿಕಾಂಶಗಳನ್ನ ತನ್ನೊಂದಿಗೆ ತೆಗೆದುಕೊಂಡು ಹೋಗಿ ಮತ್ತೆ ಹಿಂತಿರುಗುವಾಗ ಕಾರ್ಬನ್ ಡೈಆಕ್ಸೈಡ್ ತನ್ನೊಂದಿಗೆ ತರುತ್ತೆ. ಈ ರಕ್ತ ಪರಿಚಲನೆ ಮುಂದುವರಿಸೋದಕ್ಕೆ ಈ ಪಂಪ್ ನಿರಂತರವಾಗಿ ಬಡಿತಾನೇ ಇರಬೇಕಾಗುತ್ತೆ. ಹೃದಯದಲ್ಲಿ 4 ಗೂಡುಗಳಿವೆ, ಅಂದ್ರೆ ಕೋಣೆಗಳು. ಬಲಪಕ್ಕದಲ್ಲಿ 2, ಎಡಪಕ್ಕದಲ್ಲಿ 2.
Okay. Our heart is like a fist and it is located in the center of the chest. Where it is located? In the center of the chest. In anterior side we have a soft bone, that is sternum. Posterior side we have vertebral support. In between it is sandwiched. Our heart is sandwiched in between. While doing CPR, this is very important because we are posterior side is the vertebra, anterior side is the sternum, in between heart is there. So basically when the heart stops, we are artificially pumping the heart in between these structures. Okay, and suddenly he gets heart attack, and heart attack is different, cardiac arrest is different. Heart attack is like a pumping effect. Our blood is still getting pumped, but cardiac arrest is an electrical event where suddenly there is a switch off of electrical activity, cut off of electrical activity, then there suddenly patient become unconscious. So if someone, why we are focusing on BLS everywhere is everyone should know basic life support. Okay, when you are going in common man, when in around your common man, everyone expects you are a medico and they will save our life. They will not know your doctor, your nursing staff, your this that. They will know you are working in hospital. When something emergency strikes, you will help them. So basically you should know this, at least basic life support you should know. When someone is walking in the road and he become unconscious, cardiac arrest, he cannot come to hospital. One thing. Second thing, if someone untrained people, they are getting him to hospital, how many minutes it will take? How in just outside the road someone collapsed, he is getting in the hospital, means how many minutes it will take? At least 3 minutes it will take. 3 minutes patient coming in the hospital and we are resuscitating him, he will go brain dead. Is there is use for life? There is no use for life. Okay, there is only brain will survive after cardiac arrest. Cardiac arrest means blood is as the video showed, blood is getting continuously pumped. Once this pump blood goes to brain, it will get stopped. Blood to brain stops, brain only will tolerate 3 to 5 minutes of ischemia. In that 3 to 5 minutes somehow we have to start the recirculation. If we don't start, then irreversible brain damage will occur. So when you are in a road, someone cardiac arrest, you start CPR, he will survive. If you don't start CPR, he will go to graveyard. So this is why we should learn CPR. Road traffic accidents are increasing. This is 2 years back data. Electrocution is increasing, and more importantly we are here densely populated Tamil Nadu, where coronary artery disease is more common. Where coronary artery disease is more common, their cardiac arrest is more common. Every day there are more than 50 cases of cardiac arrest occurring in every day in these only 3 states. That means every hour there are 2 cardiac arrest, sudden cardiac arrest. That's why we should know CPR, and whenever the sudden cardiac arrest strikes, we should at least start cardiopulmonary resuscitation, get him into hospital. Cardiac, this is young groom dancing. Suddenly cardiac arrest occurred. He collapsed. He collapsed. Time is getting wasted. Everyone is enjoying. Still they are assessing the situation, what happened. People around him are still dancing. But for him, the time has started. Suddenly cardiac arrest occurred means his time has started. You recognize him within 3 minutes, he will survive. If you don't recognize within 3 minutes, survival chances decreases. To explain is sudden cardiac arrest. It can be patient will be unconscious. Sometimes patient will keep open his eyes. Sometimes there is a convulsive jerks. Sometimes he is on a prone position. You don't know, suddenly he has fall and is prone position. These all are sudden cardiac arrest. You should go check the 3 things. First is check his carotid pulse. Pulse means always in cardiac arrest carotid pulse. Check his pulse. See for respiration. Only abdominal movement is there, but there is no respiration, means this is also cardiac arrest. Check for pulse. Pulse is absent. Respiration absent. Then this is a cardiac arrest. You need to start immediate CPR. Okay.
Pick up hockey. Suddenly, it turns into a life and death drama on the ice. The man who just collapsed is a 54-year-old realtor, and he's having a massive heart attack. Now look at this player from the opposing team. Number 12 takes charge.
If he did not receive immediate attention, he probably would not be with us right now.
As luck would have it, number 12 is an emergency room physician. Dr. Craig Bryant immediately goes to work doing CPR, but it's not working. Dr. Bryant calls out for a defibrillator. They've got one, and here it comes.
He administered that shock and administered a little bit more CPR for another minute and a half and started breathing on his own.
This freaking man is alive.
Okay. What they have done, they called for 911. 911 is basically 108 calling for help. Immediately emergency medicine physician identified it is a cardiac arrest. He immediately started CPR. Then he called for defibrillation. Here time to defibrillation is also very important. Most of the cardiac arrest is because of the ventricular fibrillation or ventricular tachycardia. These are shockable rhythm. I will in the meanwhile I will explain what is shockable rhythm. This when time to defibrillation will give our prognosis. Once cardiac arrest happens, within 2 minutes we have given defibrillation, means the chance of survival increases. Okay. Whenever there is a cardiac arrest or the scene is safe, this is a road traffic accident, person has fallen here, don't immediately start CPR here. Okay. Once you know it is a cardiac arrest or patient is unconscious or patient needs help, then you call someone, call 108 or call your friends or call if you triple tap your someone's smartphone, it will directly connect to emergency. You connect to emergency, everyone knows this. Triple tap, it will connect to emergency. Connect to emergency. Then you go for rescue for this patient, get him to a somewhere safe place where there is no movement of vehicles, no movement of public. and make him lie flat. Then you start CPR. First is recognition of cardiac arrest, then is call for help, then scene safety should be there. This is this check. First you check, then call, then start compression. Once you know this is a victim of cardiac arrest, go assess him. Double tap on the both the shoulders. Are you okay? Are you all right? Naam kya hai? Both the shoulders you have to tap. He is not responding. Check for carotid pulse. In the center you have to see this. This is the center. This is Adam's apple. Just below the Adam's apple, laterally there is a carotid groove. Everyone can feel center. Laterally, everyone is feeling pulse. Someone is not feeling pulse.
Yes, feeling.
Not feeling. Definite pulse you will get. Center, no shortcuts. Center, Adam's apple, go 1 inch below, go laterally until you feel the pulse. I know everyone is expert, directly they will feel, but you should practice like this only. Center, okay. Best way is to identify with the two fingers. If not, with thumb you can identify. When you are checking the pulse, you should check like this. Within 10 seconds you should check pulse. Then you simultaneously check for breathing, respiration. There is a visible gush of air is there or not, and chest rise and chest fall is there or not. These are the sign of life. One is pulse, one is respiration. Or they are standing, call, if you know the name, call by name, they will respond immediately, or not. Black shirt, white shirt, pinpoint, you address him and call for help. And if he is not responding within 10 seconds, you should start CPR. You have to expose and start CPR. Previously, it was mouth to mouth respiration was there. Now because of hindrance, many people don't start CPR. Indian guidelines have come with chest compression only CPR. Only you have to give 100 to 120 compression in a minute. Okay? Do CPR.
Our heart is an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart vessel itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood, therefore not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. It does not have a chance to refill with blood, therefore no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can and don't give up until medical help arrives or an AED is present. You can do it.
This is the heel of the hand, right hand, at the center of the chest. This is the midline, the level of nipple. You have to keep the heel of your hand, and with the left hand you have to lock. Elbows should be locked straight. Shoulder should be straight, and our compression should come from hip like this. And at least 2 to 2.5 inches depth should be there. This green light is adequate depth. Okay, depth should be at least 2 to 2.5 inches, and 100 to 120 compression per minute you have to push. Okay, if you lift the hand off the chest, then the time with blood flowing the brain, it will get stopped and brain damage slowly will start. Okay, this is a chain of survival. First is arrest. Once there is a chest pain, you allow him to sit down, check his vitals, heart rate, blood pressure, SpO2. If heart rate is falling, there is a bradycardia or tachycardia, then there is a sign of sudden cardiac arrest will occur. Most likely it will occur to the patient. Immediately arrange defibrillation, call for cardiology or intensivist backup. Make him prepared for that. This is early recognition to prevent cardiac. If the patient is hyperkalemia or hypokalemia itself, or vital organ, brain and heart, or prime vital organ for the saving life is brain and heart. We are supplying buying time for the heart. Then once the defibrillation CPR, there is cardiac arrest is electrical activity. Second is pulseless electrical activity. There is electrical activity, beautiful electrical activity on the monitor, P wave, PQRS, everything is there, but you keep the hand on pulse, there is no pulse. This is pulseless electrical activity. These two are non-shockable rhythm, where shock will not help. And third one is ventricular fibrillation. Ventricular fibrillation is broad complex Q waves. Only broad complex Q waves we are giving. That is ventricular fibrillation. And ventricular tachycardia, this is broad complex. Ventricular fibrillation is only small waves are coming. This is ventricular fibrillation. Ventricular fibrillation and ventricular tachycardia is a shockable rhythm, where early shock will revert the cardiac arrest. Okay. To restart heart, defibrillation is to restart heart. Then after restarting, there is a post resuscitation care to restore the quality of life. Okay. In chain of survival, there is no CPR, there is no defibrillation, use of defibrillation, no use of post resuscitation care. Someone identified he has collapsed. They have brought to the hospital, they have lost the 3 minutes. After 3 minutes, you give defibrillation, you give shock, you give anything, that doesn't matter. Okay. Chances of survival after cardiac arrest goes after 1 minute, if there is 90% chance he will survive. Within 1 minute, you recognize cardiac arrest and you start CPR, timely give defibrillation, there are 90% chances he will survive. That's why in hospital has already gone for below 50%. Okay. If someone has suffered cardiac arrest, they have recognized cardiac arrest and they have started CPR, and while coming to hospital they have continued CPR, then his chance of survival will goes up to 90%. If they have not done CPR, they have got the patient to the hospital like that without giving chest compression, then chances will go only to 10%. This is the importance of CPR. That is why we are learning CPR. Odd time patient has suffered CPR. This is mid flight patient Isobel. In mid flight she had done CPR and resuscitated without having any special equipment. She saved the life. This is Mumbai doctor. She was anesthesiologist. There is cardiac arrest sudden in the Mumbai airport. She resuscitated the patient. She had done cardiac. This is Gayatri, anesthesiologist. She has done CPR. She has intubated the patient and resuscitated, and the patient got saved. This is telling governor who has done CPR mid-flight. Again, there are so many instances where they have done CPR and they have saved the life. This is other real life scenario wherein you can see 80-year male he has arrested. She is a medico. She is giving mouth-to-mouth respiration. Need not to give mouth-to-mouth respiration. This is 81-year-old. He is going, suddenly collapsed. People around, they have gathered. They don't know what to do. They are just seeing, watching. This lady came. Now she came in. She know it is a cardiac arrest. Immediately she started CPR. He is beginning to respire. Eighty-year-old male suffered cardiac arrest without any special equipment, without anything. Only she did 10 minutes of CPR. She could save the life. We can also save the life with timely recognition of cardiac arrest and proper CPR. Chest compression also will bring the oxygen, because after cardiac arrest what we need is circulation. Patient circulation is important rather than oxygen, supplying oxygen. Our expired breath has also 16% of oxygen. That much of oxygen is enough to keep the brain alive. Okay.
Any doubts, any questions, we can ask.
पूछना है मैं बोला
Yes, sir, if heart attack occurs, then we also give a CPR.
Heart attack, when the patient becomes unconscious, there is no pulse, no breathing, then we have to start CPR. No pulse, no breathing, then we have to start CPR. Pulse, hypovolemia is there, or some amount of breathing is there. We need to support that breathing. No need to start CPR, we need to support. He should be conscious. 2.5 inches. Okay. There should be adequate compression to relaxation ratio should be there, and minimize the interruptions. Should be no interruption. How many minutes cycle will be there? One CPR cycle is 2 minutes. 2 minutes. 5 cycle of CPR. 5 round of chest compression. 1 cycle. 2 minutes. Okay. This is next. If you lose 1 or 2 minutes, then patient will not come back. What are the only? There are 3 dire emergencies in medical field. One is cardiac arrest, where there is a circulation has stopped. Second is choking, where respiration has stopped. Third is major arterial cut, where you have to stop this within seconds. Every second matter here. Is choking, where the patient, you people has so many times encountered small baby coin, engulfing coin, someone has engulfed marble. Luckily, the patient who has coming here is in the esophagus. Esophagus is not an airway where respiratory problem won't occur. But choking, if it goes into vocal cord, airway, then how many minutes you can stop your breath? You can stop for 3 minutes?
No.
You can hold your breath for 3 minutes?
No, we can't.
So we need to open that airway. Choking is something has gone inside the trachea. Okay? If someone is drowsy, sometimes, many times it occurs when the patient is semi-conscious. He is drinking as well as eating. Okay? Or he is in a semi-conscious state. He has taken sleeping pills and he is eating, where the morsel, what we are, nivala jo hai na, instead of going to esophagus, it will go to trachea and it will block the trachea. He cannot cough, he cannot talk. Our cough and talk is because of the movement of airflow in the trachea. Our trachea is like cylindrical structure. अगर उसके cylindrical structure where the air is flowing, suddenly you have close the cap, means there is no airflow. He cannot give airflow. What we are giving is artificially we are compressing the lung to pull the whatever the thing is blocking the trachea, we have to pull. We have to make the fist. Okay, we have to make the fist and tie around. In the xiphisternum area, we have to keep our fist, and our lungs, whatever the remaining air is there in the lungs, it will propel the blockage outside. Okay. If you are alone in the chair, I'll show. This is a video where baby is getting choked. Baby is getting the sinus.
How much you choking? I don't know, a few minutes? 5? Did you? The baby's brain may be provided by oxygen for too long. Next time, call an ambulance.
She's breathing fine. I think you can start to feed her.
Yeah, what about her?
Room with a coin or marble, suddenly there is no voiceness, you should suspect and see the color is getting blue, cyanosis is there, or baby, you can see that baby, she wants to cry but there is no voice, she cannot able to cry. Okay, and she is getting cyanosed. That time you have to immediately intervene. This is called back slaps. You have to hold the baby in a tightly up down position with fingers supporting on the chin area, one finger here, 30-degree head low. We have to make the with other one leg this side, one leg that side, and give 5 back blows. If baby is conscious, you give 5 back blows. If in the process baby become unconscious, you have to start CPR. Okay, and whenever you are encountering foreign body into the airway, don't blindly sweep the foreign bodies. फिंगर डाल के निकालेंगे, सोचेंगे ऐसा, that will again push the foreign body inside. Until it is visible, you can able to catch it, then only catch it. If you cannot able to catch, then don't do blind finger swipes. Okay, put head low position, give back blows. The baby itself will throw away the whatever the foreign body is there. Now you have to push externally. Whatever remaining air is there in the lung, it will push the foreign body outside. This is another video.
We jumped in to save his choking classmate. He came home. You're here with this incredible story. I'll call it down.
Yeah, and we all know it's been around 4 years. A Heimlich maneuver. We know that name, but we think we have an idea of what we would do. But do we really? Well, this kid now, a teenager who took a course in the Heimlich maneuver, is now giving us all a lesson in what you should do in an emergency.
It seemed like just another day in the high school cafeteria for Ian Brown. This terrifying moment. Take a look. You can see Brown sitting with a group of friends when suddenly his classmate across the lunch table, Will Olson, starts violently coughing and wildly gesturing his arms, signaling for help. He's choking.
We couldn't tell if Will was choking or if he was just laughing and coughing at the same time. And eventually what started to give it away was the redness in his face and then the hand motions to his neck.
Watch Brown, just a freshman, calmly leap into action. He walks over to Olson and performs the Heimlich maneuver just 4 times, dislodging the food from his throat and in a matter of seconds, saving his friend's life.
I felt thankful I had Ian, a friend there that had the training to do what he did.
Brown says he learned to do the Heimlich during first aid training at a police department program in La Crosse, Wisconsin.
I felt I was just doing what I was trained to do. I wanted to be a police officer, and that's what they trained me to do, and that's what they told me to do.
You immediately watch the other student jump up and call for help.
He had some aspirated, and the guy who was sitting beside, he don't know what to do. But the one who is sitting in front, he was getting trained, got trained with Heimlich maneuver in police department. He came, immediately he resuscitated position.
If a person is unconscious but is breathing and has no other life-threatening conditions, they should be placed in the recovery position. With the person lying on their back, kneel on the floor at their side. Place the arm nearest you at a right angle to their body, with their hand upwards towards their head. Tuck the other hand under the side of their head, so that the back of their hand is touching their cheek. Bend the knee farthest from you to a right angle. Now, carefully roll the person onto their side by pulling on the bent knee. The top arm should be supporting the head, and the bottom arm will stop you rolling them too far. Open their airway by gently tilting their head back and lifting their chin, and check that nothing is blocking their airway. Finally, stay with the person and monitor their condition until help arrives.
Whenever you have done, because all the secretion will come out, and patient risk of aspiration will decrease. Whenever you have put the patient in a recovery position, stay by the side of the patient until help arrives. Attach some monitor at EG or pulse oximeter to monitor the condition of people have done CPR and saved the lives.
Christian Eriksen, the Danish footballer who collapsed for the cardiac arrest during his team's opening match in the Euros, is said to be in a stable and good condition in hospital.
The incident of Christian Eriksen, which we will talk about briefly later today, brought back many dark memories of such events that happened previously. Today, we have compiled a list of 5 names who experienced such tragic suffering on the pitch. Let's take a closer look at how they collapsed and what happened to their lives and career afterward. Bafatambi Gomez. The first player on our list of players who have collapsed on the pitch is Bafatambi Gomez. Although Bafatambi's case is different from the others, his inclusion was essential due to his special medical condition. The French striker has a disease called reflex syncope, a special case when a person collapses during exciting or pressurized situations. Consequently, Gomez has collapsed several times on the pitch during his stints with Swansea and Galatasaray. And here's a surprise. Gomez still plays football. Fabrice Moamba.
Within about a couple of seconds, I don't think
Some of this class is to recognize the cardiac arrest, immediately start CPR. If you have done CPR well, patient is survived, put him on the recovery position, and also you should able to relieve the choking. Okay. Anyone and they he survived? No news. Instagram. Some recently Hyderabad police has saved a patient cardiac arrest. There are so many instances. We can actually save life if we do timely CPR. In Gulbarga only, in recent 2-3 years, we have saved more than 10 patients who had come with cardiac arrest. We have given proper cardiac care and revived the patients. Okay. Now we'll for the choking, what we have to do is you hold from the back, you have to hold and give 5 compression like this. Okay. If the patient is very obese, where you cannot encircle the abdomen, you give chest thrust. Or the patient is pregnant, where you cannot encircle the abdomen, you do chest compression. Just encircle the chest and give chest thrust. Our aim is to push the whatever remaining air is there in the lung, we have to push and remove the obstruction. If the baby is there, you have to hold here. This is the prominent bony mark. You have to hold 2 fingers and place one hand with the one leg falling here, one leg falling there. Support and in between the 2 scapula with the palm of the hand, you have to hit 1, 2, 3. Okay. Hit it hard so that the foreign body get expelled. Don't hit like this. Hit hard. Okay. If the patient is unconscious, then you start chest compression. For the recognition of cardiac arrest, you have to tap on both the shoulder. Hello, are you okay? Are you all right? Meanwhile, check for the pulse. Simultaneously check for respiration. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There is no pulse, no respiration. I will call for help. Call 108 or your friend's number. Call someone for help immediately. At the center of the chest with the heel of the hand, start chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, like this, 100 to 120. If 2 rescuers are there and you have airway equipment, you go for ventilation. If there is no rescuer, you are outside alone, then you give only chest compression, 100 to 120 chest compression, 2 to 2.5 inches, minimize the interruption. If you have defibrillation, immediately attach the defibrillator and give shock. Another thing is, there is a AED, automatic external defibrillator, where you attach the pad, defibrillator will analyze the rhythm. If it is a shockable rhythm, defibrillator will give shock. If it is non-shockable rhythm, you have to continue with the CPR. Okay, you all can practice.